Hello anatomists at large. Today we'll be discussing Objective 5.4, which handles the cervical plexus and the cervical sympathetic ganglia. The cervical plexus is a network of fibers located in the posterior triangle of the neck, halfway up the SCM within the prevertebral layer of cervical fascia. The plexus is formed from the contributions of the anterior rami of spinal nerve C1 through C4. The branches can be divided into sensory and muscular. The muscular branches are shown here in pink, sensory in blue, and cranial nerves in green. We'll start with the muscular branches. The phrenic nerve arises from C3 through 5 and then travels down the surface of the anterior scalene to the thorax where it innervates the diaphragm. You can remember this with 3, 4, 5 keep you alive because breathing, it's important. C1 spinal nerve gives rise to the geniohyoid muscle and the thyrohyoid muscle. These nerves hitchhike with the cranial nerve 12, the hypoglossal nerve, and the hypoglossal canal for a little while before they reach their destinations. The ansa cervicalis is a loop of nerves formed from nerve roots from C1 through 3. It gives off 4 muscular branches: the superior belly of the omohyoid, the sternothyroid, the sternohyoid, and the inferior belly of the omohyoid. We also see here that cranial nerve 11, the spinal accessory nerve, gets contributions from C2 through 4 on its way down to innervate the SCM and the trapezius. Several other minor branches arise to innervate the other muscles of the neck and back, shown here. Now for the sensory branches. The greater auricular nerve is formed from fibers from C2 and 3. The transverse cervical nerve is also formed from fibers from C2 and 3. The lesser occipital nerve comes from the root of C2 and gives cutaneous sensation to the posterior superior scalp. The suprascapular nerves are a group of nerves formed from C3 and 4. Lastly, we'll discuss the cervical sympathetic trunk and ganglia. The sympathetic trunk is embedded in the posterior wall of the carotid sheath. There are 3 ganglia: superior ganglion, which lies at the level of C2 and 3, the middle ganglion at the level of C6, and the inferior, which lies at the level of the first rib behind the vertebral artery. In 80% of the population, the inferior ganglion is actually fused with the first thoracic ganglion, forming the cervicothoracic ganglion or the stellate ganglion. That's all for Objective 5.4. Thanks for watching.